you. By the bathroom. Yeah, there's one just right out here to the right. And if there is an emergency, we're going to go downstairs and meet over here by the parking garage, and we're going to get a head count. And if we need to find a storm shelter, where are we going? Basement, that's right. Bowling lane. So I know there's also folks that are on the Zoom call right now. So wherever you're at, practice safety at home. But let's go ahead and get started. If we can, come on. And I need a manual. There we go.
No, you went to. There you go. You're good.
Yeah, so just a little bit, SHEMA, there's an organization out there that has a lot of resources. That's why I bring it up. They practice Lab Safety Awareness Weeks. There's a lot of other institutions, a lot of other R1s, land grants, big name schools that are also participating in that. And so this is our inaugural kickoff here of Lab Safety Awareness. What we want to do is provide resources to those who do research. Research out there is what makes the world go around. We'll talk more about that. But SHEMA is where we get a lot of our toolkits and a lot of our information. So number one reason is environmental health and safety and lab safety, keeping you safe. Okay. This is not working. All right, just a little bit about me. I'm a first generation college grad, very proud college grad, put myself through school the first time, second time, and third time. But I have over 25 years experience in environmental health and safety. I worked in the private sector, worked in the public sector, higher ed. Also taught assistant professor, taught environmental health and safety courses for quite some time, industrial hygiene, environmental science, air quality, things like that. Another one is international EH&S auditor. That's probably my most valuable experience, how folks are doing things worldwide. It's really a small world out there, but a lot of companies, a lot of organizations are moving towards world-class EH&S. And there's a lot of things that, if you're providing goods and services nowadays, they don't want environmental degradation. They want, sustainability. They want LEED. Safety is, for the most part, it's it's not a question. When our students graduate from K-State, they expect, some environmental health and safety. You have lab safety awareness before you get to the Dow, DuPonts, Monsantos, et cetera. So do you practice that? I know we've got another presentation today that talks about incorporating EH&S into the curriculum. So also, last is on the slide there, certifications that I carry: certified industrial hygienist, safety professional, hazard material manager, and risk manager certification. Come on. And I can't talk here at K-State without talking about the next gen. So there's some really high level actions that we want to take here at K-State. One of those being the number 4 imperative, which is increasing expenditures, increasing awards. So with that, I envision a lot more complexity in research, more collaboration on campus, off campus. What does that mean? Well, as we do more research, we definitely need to make sure we're making a good lab design. We're practicing safe practices. So imperative number 4 there. Next slide. And the next slide is people-centered. And why are we doing this? I think it's really easy. Researchers are at the heart of making great things possible. So taking care of our researchers, taking care of our research environments, number 1. Next slide. All right, this is interactive. So Monday morning, post Super Bowl headaches aside. First question, and this goes for, since I've been at K-State for a year, public sector employee safety. What regulatory agency covers public safety employees? Or excuse me, public employees, their safety? What agency? Anybody? Don't be bashful. I heard OSHA. Yeah. So this is actually meant to be a trick question, all right? In Kansas, it's actually a state program. It's covered by Kansas Department of Labor. However, KDOL did not write their own regulations. So KDOL actually has OSHA that they cite. So by reference or incorporation, KDOL actually is the one that will come here to see K-State employees, K-State research, lab safety. So where are these safety regulations located if KDOL is the agency? Some people already said it. Go ahead. What's the answer to that? Well, KDOL's website is sourced up there, but if you go there, they have written very few of their own regulations. So some of you said it earlier, OSHA. So KDOL, you can go there, there's their source, and what it will tell you is there's very few regulations, and so you're going to go back and go to OSHA.gov. And so for the big programs, that's where you find your regulations. So lab safety, eye washes, et cetera. And we have Shane Etzel later this week. He's actually a supervisor for public sector employees, and he'll actually be speaking from KDOL regarding what you need to know in the lab. So thank you. Let's go to the next page here. All right, and with that, just to see the interplay, and this is meant for a little bit behind the scenes. So if you go to KDOL and you look up eye wash safety showers, what are you going to find on the KDOL website? Nothing. So there it is, 29 CFR 1910. You can click on that link, or you can go to OSHA's website and look up eye wash safety showers. That's it. That's all they have. So it says whenever you have injurious corrosive liquids, you need to have a quick drenching or flushing the eyes and body. So what are you supposed to take from that? If you own a lab, what are you supposed to do? That's it. So if you have a hose up, if you have a gravity fed, etc. Not a lot of information there. So the next one that we find in OSHA is under the 1910 1450, which is, it's not mandatory, but it says safety showers are available and tested on a regular basis. So we want to get into this. So the OSHA regulations say that you have to provide eye wash safety showers. Well, what are the specifications? I have planning in here, you know, through the building code and through, there's other specs, but where do you go for that information? That's all they have, the OSHA website.
We call you.
Okay, we can call EH&S, that's a good answer. Yeah, and this is also meant a little bit as a trick question, but let's go to the next slide here. Yeah, there's a voluntary consensus standard out there. So ANSI 358.1, there you get into the actual specifics of it. You can actually look at, must be accessible within 10 seconds. If you locate it, your eye wash, and you're working with really, really harsh chemicals, it needs to be within 10 seconds. It must be on the same level. You can read there quicker than I can, but you know, something that's interesting is that new ones have to have this tepid flushing mixing valve, they're calling it. And so now we have to mix it with warm water so there's not cold water, and you go hypothermic. That's a new one through the voluntary consensus standard. Also, too, at the bottom there, it's 20 gallons for 15 minutes for your showers and 0.4 gallons per minute for your eye wash. So this is what actually drives behind the scenes where OSHA was not specific, KDOL is not specific. Does that make sense? Yeah? Okay, next slide. All right, so here we go. Another question on Monday, just keep you guys in the loop. So as a public sector employee, do I need to comply with ANSI? Do I need to comply with Compressed Gas Association, NFPA, ASTM? Pick one of those. Do I have to comply with that? Yes or no? Some of you said yes, some of you are shaking your head, I don't know. All right, how many say yes, you have to comply with that? And how many say no? How many are unsure? Okay. All right, so this is, let's get to the brass tacks on this one. So technically, KDOL will write you a notice of violation. OSHA will write you a notice of violation for for the regulation that was written. OSHA also has the ability to write what they call a 5A1 general duty clause. If you don't have a specific regulation, they can write that. It's very rare that they do that. But what I tell everyone is, so if someone actually gets injured, are you going to argue I was doing the bare minimum with OSHA and KDOL, or that I care about my employees and I have a higher standard? Which one working in the lab would you go for? All right. And that's why at the end of the day, I want to make sure that everyone hears this. The ANSI, these other guidance standards, these are also, anyone can sit on these committees. You can become a member, you can sit on these committees, and these standards come out, they get developed over time. But at the end of the day, do you have to comply with? The answer is no. But another reason that it's really difficult to get written into OSHA regulations is why. Why is it really difficult to change a regulation? And so it's a political process, and how often is there consensus? Rarely. And so that's another reason why it's going to be some time before OSHA can update accordingly, because it is a political process, and that's why, as is, you have KDOL right now in Kansas, you have OSHA, and you have the ANSI standards. So hopefully explaining the eyewash safety showers, that kind of makes sense. Next slide there. Question?
I think what I'm hearing is there are a number of voluntary standards associated with various professional organizations, and there's no, strictly speaking, legal requirement to follow them unit by unit. But why does the case? Do you push out a policy from your office that it is the K-State view that this set of standards should be followed? Or is it unit by unit decision?
Awesome question. So there is a chemical hygiene plan on our website that is undergoing revision. So what we want to do in 2024, and we're going to introduce Rachel here as our new research lab safety manager for this next portion. And the answer is yes, we want to standardize that. What's the minimum that you need to do to be in compliance and also best practice? And 20 people look at a regulation, 20 people may also improve. So with that, our office is actually streamlining and standardizing those regulations and those requirements. Absolutely. Great question. Okay, coming up here on the end here of my presentation, basically, caring counts. We care about you, care about each other. If you see something, say something. Something's out of order, something doesn't look right, unsafe, unsecure, speak up. Contact DH&S. Lab maintenance, though, you got to look at the different organizations there. You need to contact different folks. But if you see something, say something. Last slide, questions, comments, suggestions. Otherwise, I'm going to turn it over to Rachel, our lab safety research safety manager. And let's see if I can actually control the slides.
Hey, everybody. My name is Rachel Weiderman, and I'm the Research and Laboratory Safety Manager at Kansas State University. I'm excited to be kicking off the first Lab Safety Awareness Week at K-State and introducing our research safety program. I started in my current position in May of 2023, but I've been with the K-State EHS team since October 2022. My position was created to fill a gap in research and lab safety programs at K-State. Before coming to K-State, I have 5 years of research safety, biosafety, and select agent experience. I was an assistant biosafety officer and senior safety specialist for lab safety at UNL, and I was a select agent specialist at NVAP. Prior to entering safety, I was a medical laboratory scientist in hospital labs for 2 years. I'm also a first generation college graduate like Joe. I have my bachelor's in medical laboratory sciences, my master's in healthcare administration. I'm graduating in May 2024 with my master's in biotechnology, and I'm currently enrolled in the K-State MPH program and a PhD program. Awesome. So research and laboratory safety is a discipline that I find to be exciting and challenging every day. Research and laboratory safety occurs outside of labs as well, in fields, clinics, farms, off-campus research sites. Here at K-State, we have approximately 2,500 locations that are conducting research or laboratory operations. Research and laboratory safety involves chemical safety, biosafety, radiological material safety, lasers, animals, specialized equipment, additive manufacturing, power tools, etc. There are no limits to what we can pursue and achieve through research at K-State. So if you can dream it and you get a grant for it, we can collaborate and do it safely. So today I wanted to introduce the program elements for the Research and Lab Safety Program that I'm focusing on building, revising, and reinforcing in 2024. These include hazard assessments, hazard communication, including updating our lab science, chemical inventories, incident and near-miss reporting, safety and compliance inspections, fume hood inspections and biosafety cabinet certifications, and an autoclave validation. Before we get started discussing the program elements for research and lab safety, I wanted to briefly remind and introduce us to the hierarchy of controls. The hierarchy of controls is a diagram that helps us understand what controls we might implement to mitigate risks, and it also helps us understand which of these controls is most and least effective. So when we're looking at the controls, elimination is going to remove the hazard at the source. This might be choosing a less toxic chemical, maybe getting rid of radioactive isotopes, or even eliminating sharp tools in your research. We know that elimination is preferred, but as researchers, we also know that's not always possible to obtain the research results that you're going for. So then we start looking at the other control methods. Substitution is using a safer alternative to your hazard. When I think of substitution, the classic result I think of is using the K12 E. coli strain instead of the pathogenic E. coli for labs. I've also replaced pathogenic E. coli with this strain for training. Administrative controls, engineering controls isolate people from the hazard. Two good examples at K-State are biosafety cabinets and fume hoods, which you'll hear more about tomorrow with Lab Conco. These engineering controls isolate people from the hazards they're working. Administrative controls establish work practices that reduce the duration, frequency, or intensity of exposure to a hazard. These change the way that we work. So if you establish a lab-specific SOP, this is an example of administrative control. Another good example is lab signs. They can outline access criteria for your lab and limit who can access hazardous materials. Lastly, PPE, personal protective equipment, is our least effective control method. It helps protect people should they come in contact with a hazard. PPE alone should not be relied on to control hazards and mitigate risks of exposure because other control methods on the hierarchy of controls are more effective. So I want us to be thinking about the hierarchy of controls this week throughout the various presentations, and then when you also go back into your laboratories and look at your operations. So the first thing I want to look at for 2024 is hazard assessments. This is the definition from the OSHA PPE standard 1910-132D1. It states that the employer shall assess the workplace to determine if hazards are present or are likely to be present, which necessitate the use of personal protective equipment. So the purpose of conducting a hazard assessment with the Research and Lab Safety Program at K-State is to examine our physical spaces and our operations for known or potential hazards. The hazard assessment form will be filled out by PIs and lab managers because you have the best knowledge of your lab and your operations. We're here to help you with filling that out, but we respect that you have the expertise. This form also provides PIs and lab managers the opportunity to inform emergency responders, EHS facilities, and the community of hazards and access requirements. So what hazards might someone encounter in your laboratory or operations? Knowing that, who should have access to your laboratory and who should not? What access restrictions would you want to put in place to keep others safe? The hazard assessment form also has a PPE assessment tied into it, where based on identified hazards, PPE requirements for entering the space are outlined. And then lastly, new lab signs will be generated from the hazard assessment, PPE assessment, and your updated chemical inventory. PIs will help select what information should be communicated on the lab sign for entry into their space. So these are just some of the following elements that are on the hazard assessment form. I do want to highlight, though, that there are many more elements that may be present in your laboratory or for your research, and that our form is customizable. So my goal with the form is to capture each unique space and operation and make sure that we're protecting you and protecting anyone who may enter your space. This is just a preview of what you'll see when you go to our hazard assessment form. The link to the form will be posted on our website next week. And then we're wanting all PIs and lab managers for one space, either the PI or manager, to complete this form in 2024. The laboratory PPE assessment that's tied into the form is based on your hazard assessment. This outlines the hazards and associated PPE used to protect against hazard. And this PPE assessment will be on the lab sign. So what you choose for eye protection, that will be reflected on your lab sign, and anyone entering your space will be expected to wear that. You may outline eye protection, hand protection, foot protection, protective clothing, respiratory protection, hearing protection, or specialty PPE based on the research that you conduct. So the OSHA Hazard Communication Standard, which is 1910-1200, intends to ensure that employers inform employees of the risks of working with hazardous chemicals. Section B3 is the section that's specific to laboratories, and these are the following items that they expect that we adhere to. So when you buy a chemical from the manufacturer, this standard states that you are not going to remove or deface that label. If you're going to repurpose the container later on, it is fine to deface and relabel, but as long as the original chemical remains in the container, you cannot deface the label or remove it. The standard also expects that we're going to maintain SDSs readily available in the laboratory. And we all like to have electronic copies, but we also recommend having the binder of the original copies from the manufacturer should there be an emergency or a time where we cannot access your electronic copies. The standard also prescribes that we're going to provide information and training as an employer. So this training needs to include methods or observations to detect presence or release of chemical. And I wanted to take a second to show you. So in EHS, we have a PID, a photoionization detector, and we have a whole chemical library that we can select and monitor for concentrations actively. So if you are working with a chemical and you want to see what your exposure level is, you can call us. We can see if we have that in our library, and we can come over and monitor while you're working. So this is a pretty cool tool that we're starting to use. We just used it for formaldehyde monitoring in anatomy lab to show actively which spaces had more exposure to formaldehyde.
This is for liquid and gas and solid, everything.
So the PID is looking at what is in the air. That's how it's measuring it.
Yes.
Yep. So what you would be breathing in. Yep. So they also want us to provide training on the hazards of chemicals. So what chemicals are used in your lab and what are the hazards associated? Measures to protect for chemicals. And then we are expected to have an employer has communication program. So this should include what are K-State labeling requirements for chemicals, what do we prescribe for maintaining SDSs for chemicals, and then how should employees obtain and use hazard information for chemicals in public areas. I also wanted to highlight the globally harmonized system pictograms that are part of the HAZCOM standard. There are 9 of them. These are prescribed by OSHA to ensure that everyone everywhere is using the same labeling for chemical hazards. And then to be compliant with the OSHA HAZCOM standard, these need to be printed in color. So we'll see that change on the lab sign. So laboratory signs at K-State are meant to convey the elements of the hazard assessment and hazard communication for your specific laboratory. I revised the previous K-State lab signs that you see everywhere for 2024 with the goal of revision to communicate hazards more clearly and update hazard communication methods and then also to add space to define access criteria for every space on campus. So the first thing I did was remove chemical safety levels. Unlike biosafety levels, chemical safety levels can be poorly defined and misinterpreted, and the OSHA has comp standard prescribed using GHS pictograms instead. So I added GHS pictograms so we can be in compliance with that standard. The NFPA 704 Diamond is what firefighters, emergency responders, and police are trained on, understanding what material hazards are and the severity of the hazards if they were to respond to your space. I also added access criteria. I think it's important for everyone to know who can enter a space, and if they were to enter that space, what are the access requirements, and if prior authorization or escorted access is required. So up here, you'll see an example of the new lab sign. So the changes that I just mentioned are on here. Some of the important things to note: we are requiring a 24/7 emergency phone. That way, if there were something to happen in the middle of the night, someone who is very familiar with the research operations and what is stored in that space can be reached. We also have the access requirements defined in the middle. This is up for laboratory managers and PIs to tell us who can access their space, and if you can't access the space, do I need to be escorted? What do I need to do to get into the space? The QR code in the middle of the sign will link to our website and will describe what each of the hazards are, what the NFPA Diamond stands for, and any other information. So if I'm standing outside of a space, I can quickly reference and interpret what these might mean. And then lastly, the process to get the sign is to fill out the hazard assessment. I'll complete the sign, send it to you and your department safety coordinator to review, and then you'll be able to print, color, and post on your. So chemical inventories are another really important tool for laboratory safety and security. It's important that every lab on campus is going to maintain a complete, accurate, and up-to-date chemical inventory at all times within the lab space and also on EHS Assistant so we can see it on our standard. The inventory should include elements such as the full chemical name, chemical cast number, manufacturer, quantity, storage location, and be tied to the SDS and EHS Assistant so we can review if you were to have an emergency or a spill. Whenever new chemicals are purchased or chemicals are used up, you should be updating this inventory in real time. Also, when you update this inventory, please understand this may affect your hazard assessment and lab science, so just check and make sure your hazards have not changed. So I wanted to just provide a quick view of what my PI dashboard looks like in EHS Assistant. So when you guys go back to use yours, you can see what it might look like. And this is on our website under the lab safety tab and then chemical management. And then this is just a preview of our quick chemical entry page that's also listed on the website. And we have a really great detailed, like step-by-step instruction PDF for you to add chemicals, but we're also happy to help you get started or add chemicals if you need. Incident and near miss reporting is really near and dear to our hearts in EHS. It's a metric that we track and it helps us improve our programs. So we are encouraging strongly all near misses and incidents to be reported through the K-State EHS reporting mechanism on our website within 8 hours of occurrence. This allows us to look at the incident, look at our programs, and potentially prevent another incident from the same cause. So an incident is an event where an injury or an accident actually occurred. A near miss is any out of order condition or work practice where an incident would be possible. After reporting to us, there's a reflex on our form for supervisors to conduct a root cause analysis to determine what may have caused the incident and allow for remediation before another incident occurs. We are in EHS tracking incident trends and reporting out to departments and letting them know what their most frequent incidents are, maybe what time of day, what day incidents are, and locations and operations. So this is a really good illustration that multiple researchers have studied to discuss the importance of reporting near misses and unsafe actions or out of order conditions. So among multiple studies that I've read, it's around 90 to 300 near misses before you have a serious incident. So if we get proactive on reporting our near misses and unsafe actions, we're able to prevent the tip of the iceberg incident that happens. the out of order condition that you report today can prevent an injury tomorrow. Laboratory safety and compliance inspections by EHS are new to campus for 2024. These inspections aim to ensure regulatory compliance with multiple agencies, codes, and standards, and also ensure that labs are adhering to known safety best practices. These inspections are going to be triage for labs that haven't had routine inspections. So some departments on campus are already conducting routine inspections. Some people are getting inspections through having research protocols, but some people are kind of left out of that mix. So that's where we want to visit first. I believe that inspections are a very collaborative process. I like to come to your lab, learn about what you do, and help you do it safely. They should not be punitive, and we should work together so that when I leave your laboratory, we leave it safe and compliant. Some of the topics on the safety and compliance inspections include hazard communication, chemical safety, biological safety, electrical safety, security, emergency response, fire and life safety, administrative controls, hazardous waste management, and PPE. Prior to conducting these inspections, we'll make sure that you have a checklist for these items. So I've audited multiple campuses and thousands of laboratories, and I have a top 10 of items that I routinely see everywhere. So feel free to take a picture of this slide if you want, but my challenge for you guys when you go back is to look and see if you have any of these items. So the first one, all chemical containers, even transient ones, should be labeled with the full chemical name, the date that you're using it, and who generated it. The second one, make sure your chemicals are stored compatibly, and if you do require a ventilated cabinet or a flam cabinet, that your chemicals are in those cabinets. Third, compressed gas cylinders should always be restrained, and when not in use, please put your valve cap back on the top. Fourth, please make sure your chemical inventory is always up to date and accurate, and that you have SDSs in your lab for every chemical that you possess. 5, PPE use should be consistent. If your lab sign says that to work in your lab, it requires a lab coat, safety glasses, gloves, closed-toed shoes, any of those items, if we come into your lab, we hope to see you and your lab members wearing those items, and we will wear them too. 6, fume hoods should be inspected every year, and biosafety cabinets should be certified every year. So please check the certification or inspection sticker on your cabinets and hoods, and let us know if they're out of date. 7, eye wash stations should be flushed weekly, and keep a record of this. This is just activating them for a few minutes, making sure that you have clear water, consistent pressure, and that your eyepiece covers are coming off when it's activated. 8, please keep your laboratory door locked if nobody's in your laboratory to protect your materials and protect you. 9, 3 foot of clearance should be maintained in front of all electrical panels, breaker boxes, and fire extinguishers. Please make sure these remain accessible and unblocked. And 10, it's really tempting to store stuff on top of lab cabinets, but we do need to maintain 24 inches of clearance from ceilings if you do not have sprinklers in your room, and 18 inches of clearance if you do have sprinklers. Okay. The campus fume hood inspection program prescribes that all fume hoods on campus are going to be inspected on an annual basis. I'm in my first year of taking and managing this program and inspecting fume hoods, so I'm making some revisions and establishing a consistent schedule so you know what month each year we're going to be in your lab to do an inspection. There are 2 different main tests that I use to look at fume hoods. First is a qualitative smoke test, which allows me to visualize the movement of smoke through your fume hood and allows us to see if it's consistent, if there might be a dead spot, if your storage is blocking airflow, or if you're not pulling enough air. The second is our velometer, which is quantitative, and it's a hot wire. So I brought that with me. So this is the instrument, and this is the hot wire. And it's pretty cool technology. All my physics folks in the room understand hot wire. So this is a little hot wire up in here. And when I put it at the face velocity of your fume hood, there's a wind current going through the hot wire, and it calculates from this wind current how much heat is being removed from this to give us a face velocity of feet per minute. We also have a cool new tool that Joe's holding up, it's a grid that allows us to take 4 points of measurements at a single time at the base velocity of a fume hood. And I'm currently working on validating them side by side in the field so that I can use that one and be quicker. But we're just wanting to make sure that we're getting consistent readings between the two. And then for fume hoods, what we're hoping to see is 65 to 125 feet per minute as your average base velocity based on the hazard assessment of what you're working with. We don't want to see any value that's greater than 20% variant from your average value. And on a case-by-case basis, we may approve lower or higher base velocities. It'll depend on what you're working with and what type of fume hood you have. Okay, biosafety cabinets. So biosafety cabinets are similar to fume hoods in that on an annual basis, you should be having your biosafety cabinet certified. Certification is different than fume hood inspection. So certification is up to the NSF ANSI standard 49, which prescribes how the cabinet should be constructed, how it should operate, and how it should be inspected for certification. So certification is required whenever they're installed in a space, whenever you move it, and on an annual basis. Using a biosafety cabinet that's not certified puts you at risk of being exposed to biological aerosols, and it puts the environment at risk if your filter's compromised. So this program's in draft for 2024, and we're hoping to establish that all biosafety cabinets on campus will be certified on an annual basis from an accredited certifier. Lastly, for me, autoclave validation program. Autoclave validation is going to ensure that your autoclave is sterilizing properly. So we have two different indicators, chemical indicators and biological indicators. Chemical indicators, most everyone is using at all times. This is like your autoclave tape, where if you put it on your autoclave bag or on your glassware, and you take it out of the autoclave later, it's going to have stripes that turn color. This color change is based on reaching a specific temperature for a specific time. However, biological indicators are different in that they're vials of live microorganisms that need to be sterilized and killed. So when you're doing biological indicators, you're going to put it in the center of your load where you would hope to have a kill of any other microorganisms, take it out, incubate it, and then after approximately 48 hours, you'll be able to analyze the vial for a color change and turbidity change to know that you've killed all microorganisms that were viable. This is very important because we may, on the chemical indicators, be reaching our temperature in our autoclave, but we may not be having our full successful sterilization cycle that we can only validate through biological indicators. So if you have a biological indicator that fails, you usually rerun it once. If it fails a second time, it usually indicates that your autoclave is going to need service. So I am drafting a program that prescribes that all autoclaves that are intended to sterilize biological materials need to be validated on a routine basis through biological indicators on campus.